that we can update you to the best of our knowledge about where things are in the field of legislation at the state and federal level. Some key points of concern that we know EMS have expressed to us, and some things that we know are on the horizon that we think you'll be interested in. With us tonight is our Executive Vice President, Terry Hamilton, Vice President, Mark Devers. Terry is from the Rockland County area. Mark is from the North Country, as we affectionately say, South Canada. Our presenter today is Steve Kroll, who is the co-chair along with Mark of our Legislative and Government Affairs Committee. Steve is a leader in his local agency, on the board of his local hospital, not only a member of NYSVARA's board of directors, but a member of the NAEMT board of directors, a past chair of the New York State Emergency Medical Services Council, and a current chair of the council's finance committee. Steve brings a wealth of knowledge based on his past experience with Haney's in legislative advocacy role, and as a staffer for the United States Senate. So we're fortunately to have the team here, and I'll turn it over to Steve and the crew.
Good evening, everybody. Thank you, Henry. And it's a pleasure to be here tonight. And we have about 50 participants from all over the state. And a lot of EMS leaders have joined us, and we appreciate all of you coming to be with us. Tonight, we are going to talk about a number of topics. And when we conceived the idea of having this town hall meeting, we recognized that there's a lot happening in EMS right now, and we're not going to focus on every single topic in great depth because we could be here for quite some time. We thought tonight, as an overview of the topics we've listed on the screen, I would ask everyone, if you're not chatting, you please keep yourselves on mute. That will help us out a little bit. So you can see here tonight, we're going to do an overview of the New York State budget, a little bit about the legislative session that's underway, a federal legislative update, talk about the regulatory discussions on ambulance offloading delays, the New York State 2023 evidence-based EMS agenda for the future. And I know that the chairperson of that group, Mr. Bonatti, is with us tonight. And then a little bit about the local partial property tax exemptions. So with only an hour and 10 minutes, we obviously only have about 10 minutes for any one of these topics. And we can get into very great depth on all of them. So we certainly think this is the first of a series, and tonight will be an overview. Certainly the chat box is active, and if anyone has a question they want to submit, you can stick it into the chat box. We will have an opportunity for some dialogue as well during the meeting, but let's just start by hopping into the topics. And Terry and Mark will join me as they'll be doing the color commentary as I go through the presentation. So the first thing we want to talk a little bit about is the New York State budget. If you were to look on the NYSVARA website, you would see under our agenda, the NYSVARA legislative agenda and regulatory agenda for 2023. And one of the things that we are advocating for is for the full cost of treating Medicaid patients to be covered by the program. As I think everybody knows, EMS agencies currently lose money on Medicaid transportation because the fee schedule has not kept up with our costs. There have been various studies of this that have been done. There are more studies being done. There's been a study done at the federal level. The state did their own study, and we're very pleased that the governor's executive budget proposes to continue making additional incremental increases in the Medicaid ambulance reimbursement. It will increase payments for more complex patients using what's called a relative value unit scale. So it won't just be putting money into the ambulance fee schedule as it stands now, but there'll be some reform in payment that will be happening over the next couple of months. But we're pleased that a good chunk of money is being added to the Medicaid rates. I wish I could tell you what the Medicaid rates would be going forward. I wish I could tell you how much is going to be ALS and how much is going to be BLS. That was not included in the budget, but what we know is they recognize that the Medicaid reimbursement is too low, specifically for more complex patients. So patients that are being coming in through emergency calls, and an effort will be made to increase that. So that's good news. It's something that we've advocated for. It's something Onion's advocated for. I think it's someone everybody in the EMS field thinks is important. So that's some good news in the beginnings of the budget. The other good news is that in the budget debate, the Senate and Assembly have accepted this funding, and it should be clean. This is something that should go through when the budget is completed on about April 1, since both houses have accepted this concept going forward. Another thing that has been in the budget is the uniform assessment program. We could spend a lot of time, we could spend this whole call talking about the uniform ambulance assessment program. And indeed, we have had specific calls on this hosted by Onion. I think even one specifically for the NYSVARA members. The idea here is that we take a pot of money that is obtained through assessments on ambulance providers in New York State. That money then is going to be sent to Washington, D.C. for matching, because the Medicaid program is a federal state partnership, and basically the federal government matches the money that is spent by a state. So we would collect some money here in state. That money would be matched at the federal level, and that would flow back to the state and be reinvested in providers. We're not going to get into great detail on that, but the good news I would tell you is that the Senate has included that in their budget. It was not included by the Assembly. So one of the things we have to do going forward as we talk to our representatives on the budget is we want the Senate position. We want it to be kept in the budget when it gets done, so we can begin this program next year. Another item that's in the budget that was put in by the governor's office is permitting ambulances to treat patients in place or take patients to urgent care clinics under the Medicaid program without sacrificing payment. This will decrease the number of unnecessary emergency room trips and also help us deliver the right care to patients at home or in a non-ER setting. We all know how busy the ER is today. We all know how long people have to wait when they go to the ER. And our hands have been somewhat tied about alternatives to taking our patients to the ER, partially because of the budget. If we do treat in place with people, we take care of them in our homes, or we take them to alternate destinations, the Medicaid program won't pay for it. That's a problem for us because as it is, our industry is under financial stress, and we'll be able to be much more robust in doing these kind of initiatives if there is payment by the Medicaid program for the treating in place or alternate destinations. And it looks like that's going to be in the budget as well. So we're pretty excited about that. So that's the straightforward part of the budget. The next part of the budget I'm going to talk about, and then Mark's going to give some color commentary, is what we call the Part S reforms. The governor proposed a lot of reforms in the New York State budget for EMS. There are a lot of reforms proposed last year. That last year was called Part F. That did not come to pass. A lot of work has been done in the last year on sending suggestions to the governor's office through the State EMS Council, through a lot of the people on this call have been involved with that. And there are a number of things that have been proposed. I'm going to just give a little bit of highlight on them. There's a lot more that's been proposed in this. There's about 20 or 30 pages worth of full material, but these are the highlights. There's some things that we support in concept. When I say we support in concept, there's going to be a robust back and forth over the next couple of weeks before the budget is done about the finer points of language of the legislation on some of these things. In addition, all of these things will have to be implemented through a regulatory process. There'll be a lot of discussion about the finer points of it during the regulatory process. But in general, we support conceptually the expansion of the definition of EMS. Right now, we are hamstrung on things like community paramedicine because EMS providers are relatively narrowly defined in New York State law. We're working to expand that a little bit. And so there's a new definition that basically says we can participate in care not only when we're responding to a 911 call, we can participate in things like community paramedicine. That has been proposed, and we're pretty excited about that definition. The second thing, there is an investment in the EMS workforce training and education. Not going to go through it in great detail here, but the state is proposing to come up with different ways to do the education and learning, to invest money in the training and education, and also the same on recruitment and retention, a recruitment and retention pool of monies and programs, because as I get further into the program, I'll show some statistics on the number of EMTs and paramedics in New York State, and it has dropped dramatically, and a lot of us are suffering workforce shortages. On the volunteer side, a lot of us are having workforce shortages, not be able to retain volunteers and recruit new volunteers. And for those of us that are at hybrid agencies, the same thing. On the paid EMS side, people are stretched to finding people to cover shifts. I am myself at a hybrid agency, and one of the challenges I have is I don't have enough volunteers sometimes, and I don't have enough of my career folks sometimes. And so I need help in both of those places. And I think our full-time career agencies certainly are in the same boat. So any investment in recruitment and retention is important. Another discussion is the development of EMS agency performance standards. And like all the things that I've already mentioned, there's been a good amount of conversation over the last year or two. And I'll give Ryan Greenberg some credit for having led us in discussions that I've been part of for the better part of now 2 or 3, 4 years about how do we put in place some standards for agency performance. And it's not a topic that comes without controversy. We have EMS agencies that are not answering many of their calls and are not changing and catching up with the innovations that are happening. And one of the questions we have to ask about ourselves is, do we have to hold ourselves accountable to standards? And what are those standards going to be? And if people cannot meet those standards, are we going to take action, whether it's a regulatory action? I know that at NYSVARA, we talk a lot about the recognition that we can't all be the same as we were 10 years ago, 20 years ago. We have to think about what our communities need for the future, and we're about serving our communities. So the budget will put in place a mechanism to develop EMS agency performance standards and give us some teeth to enforce those standards or to make those standards real. Again, not great detail. There'll be a lot of detail that has to be worked out, but conceptually, this allows us to basically set a performance level that EMS agencies will have to meet over time, put in place mechanisms to get them help in meeting those performance levels. So leadership development. Next item that's in there that conceptually we like is the authorization of mobile integrated healthcare. That is next step in the we do have some community paramedicine in New York State right now, mostly around COVID-19 treatment. It is extraordinarily limited to what it can be. So if we can get that done, that will allow us to become more than just the EMS agencies we are today, become full participants in the healthcare system. And the last one is creating a statewide comprehensive EMS plan. And you might ask, what is a statewide EMS comprehensive plan? That's yet to be determined. But the concept here is we need stakeholders, government being a stakeholder, private sector being a stakeholder, EMS being a stakeholder. We need to be talking about what EMS should look like for 5 years from now, 10 years from now, and how are we going to get there? So put in place a conceptual planning framework where we can develop a statewide EMS plan. So those are things we support in concept. There are a couple of things we do not support. One is the proposed methodology to replace the CON process. I think all of us think the CON process needs to get better. However, we did not feel that the proposal that was put forth really gets us where we want to go. They did make some changes in moving the CON process from the regional place to the state place. But I don't think it cleared up the things that have really caused the backlog in CONs, and we felt that it might lose the local flavor. So we do not support the changes in CON process at NYSVARA. The other thing that I think needs a lot more discussion is the concept of creating 10 regional EMS districts with EMS oversight responsibilities. That is something that is still relatively undefined. There needs to be a lot more meat on the bones about what these EMS districts would be, what they would do, what their authority would be. So we didn't feel ready for that really to be part of this budget debate. And so we have asked for that to be removed. So that's the major tenets of this that I'm going to now move forward. And some of the good news here is that the New York State Senate and New York State Assembly did not support in their one house budgets the methodology to replace the CON process and the creation of the EMS districts. So they heard the message from EMS providers. The state EMS council weighed in against it. Some of the regional EMS councils weighed in against those specific provisions. And with the Senate and Assembly not adopting them, it's pretty likely that they will not be in the budget. And those items will remain under discussion, even though we have to remind our senators and assembly members to stay strong on that. Some of the other things that we had talked about that we support conceptually, the definition of EMS has been accepted by the Senate, but rejected by the Assembly, and you'll see that has happened in a couple different places. We're disappointed in the Assembly. We know that there are interests in the healthcare field that have not supported the expansion of the definition of EMS. Some in the nursing profession and in the nursing unions have felt that we were getting too far into what they feel is their scope of work, so to speak. And so the Assembly has been very hard to convince about the expansion of the definition of EMS. We're working hard with our senators to try and get this into the final agreement. I would not be surprised if there was some compromise back and forth between the Assembly position and the Senate position. But as it stands, we've got one house that has picked up the language that the governor proposed, and the Assembly that has said no. There's a lot of give and take in the budget process. We know that 2 of the 3 parties at the table are for this. That's better than 1 of 3 or 0 of 3. The investment in EMS workforce training and education and the investment in recruitment and retention, that has been accepted by both houses. That means that all 3 people at the table are for it, and it'll go forward. And then you'll see the last 3 things: the development of the performance standards, the mobile integrated healthcare, and the comprehensive EMS plan were all 3 accepted by the Senate and rejected by the Assembly. And again, we have 2 of the 3 parties at the table that are for them. So I'm going to now turn it over to Mark Devers. Mark's a member of the State EMS Council and has been very involved in a lot of the discussions of reform over the last couple of years for a little bit of color commentary on Part S. Mark, go for it.
So, as Steve alluded to, the I guess really good news is the parts of Part S that we all hated got completely kicked out. The districts and the CON, there was not a lot of support for any of those parts. The districts, I think, more because we didn't really know where they were going with them and who they were going to be responsible to and where the oversight was and what their actual intent was. It sounded like another level of bureaucracy. And the CONs, we need the local color, the people in that region know what's going on and what the needs of the region are better than the state. And, the state also is kind of slow sometimes and puts us into predicaments because they don't move very fast and things change rapidly in the environment. A lot of the other concerns I've heard on Part S is there's some wording issues, and I do not dispute for a second that the difference between advise and consent of the SEMSCO are words that we would love to see. And I guess, I would really encourage everyone to peruse through Part S, break it down yourself. We have some documents that have broken them down that you can email us for, and we'll gladly provide, to really make up your own mind on what you support and what you don't support in it. The performance standards is one that's a hot button issue because it is going to affect agencies, and it may put agencies out of business, maybe a burden on other agencies. The question is it what's in the best interest of the system? And, if you've seen one EMS system, you've seen one EMS system. So how is it going to affect your specific system? And really, something I would encourage everybody to do, whether you want to get into mobile integrated health or not, is talk to your assemblyman and change the definition of EMS and authorize mobile integrated health or community paramedicine so that, we can start doing these proven mechanisms that actually help communities. They save the taxpayer money, they're revenue generating for EMS. And quite frankly, in a lot of cases, it takes care of the patients that we see the way too much. The frequent flyers that we spend a lot of time with, we can, in a lot of cases, limit our interactions with them. And finally, again, I don't understand why they would reject a statewide comprehensive EMS plan. The work is on the REMSCOs, the work is on the SEMSCOs to develop a plan for their agency or their area. That includes, mutual aid, that includes training requirements, that, operational requirements to help agencies and to provide a path forward, over the next several years for EMS. Thank you, Steve.
Thank you, Mark. So to close out this section, one last set of comments. It is no small feat having the state legislature debating your topic during the state budget. It's no small feat getting the governor of New York State interested in your topic. For 2 years in a row, there has been a lot of interest in EMS because EMS needs a lot of work, needs a lot of help. There are a lot of things that need help in the budget, and only some of them get done every year. It's a testament to our advocacy already that these things are getting noticed, that they are being addressed. And I recognize that now we all have to figure out how to take these proposals and concepts and make them into something that we either support or don't support. What I would encourage everybody to do is read Part S, get a hold of it, and talk with the folks at your regional EMS council, your REMAC, about how you feel about it. What are your positions on it? What should be changed? And talk with your legislators about it locally. A couple of the REMSCOs have taken positions on it already. There was a vote at the state EMS council on it about different pieces of it. But now's the time to weigh in, because there's a pretty high likelihood that we're going to see some of this in the state budget. And your assembly member and senator can basically carry your message about how to fine tune it. All right, so the next thing, just talk about some statistics for you as we go into this legislative session. These are numbers that were recently released by the Department of Health at a meeting that I'll talk about in a few minutes about the number of EMS certified responders that are working in New York State. We at NYSVARA have taken the position that we need to increase the number of certified EMS responders by at least 20,000 by the year 2025. There are 78,000 certified EMS clinicians in New York State in 2022, but that's a misleading number. In only 42% of them are active. So what does active mean? 42% of the EMS responders in New York State had their name on a PCR in 2022. So we don't know what the other 58% are doing. Have they retired and left the field? Have they gone on to do something else? Are they working using their EMS skills in some other job? I don't know the answer to that question, but what we do know is that only about 33,000 EMS clinicians, so EMTs, paramedics, AEMTs, critical care techs appeared on PCRs in the year 2022. That's a really low number. And the number of active EMS clinicians has decreased by 17.5% since 2019. So you know what the workforce shortage that you face in your agency is, whether it's not enough volunteers or whether it's not enough career people. But these are statistics you can take forward and use when you talk to folks about the real crisis we have in personnel and what we need to do statewide to help get the numbers up. We need to train a lot of EMTs and paramedics in a very short time, because I'm not getting any younger. So and some of us all can all say that. You know, I'm in year 40 of my EMS career here. So I'm not going to be here in year 80. So we're going to, you know, there has to be a younger generation of people that come to work in this as well. All right. So other items on the legislative agenda, we are for increasing the $200 New York State volunteer ambulance worker and firefighters tax credit. 200. It's nice that we have a tax credit, but that should be a much larger number. We have floated the idea of $500 or $1,000 as that tax credit, whether it goes up incrementally or it goes up in one jump. We also would like persons to be able to take the tax credit in the local property tax exemption, and we'll talk about the local property tax exemption in a little while. Unfortunately, right now you have to choose one or the other. If you take the new property tax exemption, you can't take the tax credit. We think people should be able to take both, and so that's one of our positions. We're also supporting direct insurance reimbursement. This is a bill that's been around the legislature and we've been working on for quite some time. This would allow us to get paid directly by insurance companies for patients that are not participating in the insurance plan. Right now, what happens is if we transport somebody to the hospital who is not, and our ambulance agency is not participating in the network of the insurance plan sends the bill to the patient, and then we send the bill to the patient submits it to the insurance plan, and the insurance plan pays the patient. And then we have to go collect the money from the patient. We lose a lot of money by patients who don't pay us, and we have to chase them and go to collections. And I've talked to EMS agency leaders who have patients who've almost made a career of this. They can take 20 rides to the hospital and pocket the money 20 times and not pay. So there are bills in both the Senate and Assembly that would support direct insurance reimbursement, meaning that the insurer would pay us directly, even if the patient's health plan is out of network with the ambulance provider. We support the Senate bill, S1466 of the Assembly bill. The Assembly bill has some restrictions. It carves out New York City. Second of all, it also has a limit on, basically puts price controls in place. And so what in the Assembly bill they say is, okay, we'll do that, but we're going to dictate what the price is going to be, and we're going to lower the price. That is not where we want to come out. We're in support of the Senate bill. The last thing I'll mention about the general legislation is we support establishment of education and loan forgiveness and similar programs like low interest mortgage programs for volunteer ambulance workers and firefighters. And it's very simple. We want to encourage people to come into EMS. I'll talk about the tax credit, the property tax exemption in a little bit, but there are all sorts of ideas about things like paying back people's student loans if they work as an EMT in their community for a number of years. Or if you work as an EMT in your community, we will put you into a preferential mortgage pool so you can afford your first house. So there are all types of proposals like that we support. So those are just a couple things from our legislative agenda. And again, you can see our legislative agenda if you go to NYSVARA.org and go look at our agenda. So I'm going to move on now to the New York State evidence-based EMS agenda for the future. And after I present a little bit, Terry Hamilton's going to do our color commentary on this one. Over the last year and a half, a very large number of EMS leaders came together and formed a sustainability technical advisory group to the State EMS Council. It was led by Michael Benatti. I believe Michael's joined us on this call today. A couple dozen people worked on this from NYSVARA, included myself and Mark and Terry, Jason Haig. And our goal was to try and put together a roadmap for thinking about the future of EMS. Incredible amount of work was done by a dozen, 10 or so subcommittees. Then we pulled it all together and we had some folks help us, and we put together 25 recommendations for EMS sustainability solutions. This started out as hundreds of pages of work. We narrowed it down to something shorter, and there's a nice executive summary. There's a link to it on the bottom of this. And by the way, I'll tell you how to get these slides at the end of the presentation. But if you go to the Bureau of EMS website, you can find the sustainability tags report yourself. These are principles for discussion. They're not absolute. So you're not going to see a proposal all the way fleshed out. For example, one of the recommendations is fund a 3-year, $5 million campaign to promote EMS volunteerism and careers in New York State. Why is it 3 years instead of 5 years? Why is it 5 million instead of 7 million or instead of 4 million? We didn't get into that great level of detail. And so what will that campaign pay for? We also didn't get into that in great detail. The idea was to put out recommendations for things that will make the EMS system better. We've got 25 of them. Time precludes me from going through all 25 of them now. But what I want to say is this is really recommended reading for everyone on the call, for all EMS leaders. If you haven't downloaded this, please read it. In the 25 recommendations, there are a couple that I'm not sure that I'm so wild about, but there are a lot of them that I really am wild about. So I look at it as a menu. As we discuss EMS sustainability in New York State, we're going to talk about each of these 25 recommendations and which ones are the ones that will get a consensus through public policy discussions and become reality. Some of them are actually in the state budget, right? The state budget has recognized that we need to increase the number of certified EMS providers. It's recognized we need a campaign for EMS volunteerism and career promotion. It's recognized the importance of mobile integrated health. So I can already see some of the work in this report happening. It's also being used as a reference document by the recently launched New York State Rural EMS Task Force. I noticed in the chat waiting room that we've got some members of the task force even here with us tonight. It's made up of representatives of rural communities across New York State, and they're taking a look, and this was a law was passed that formed this rural EMS task force. NYSVARA was fortunate to be able to recommend the NYSVARA member who was on that task force, and there's a lot of rural EMS people that many of us know are serving on this task force, as well as leaders in education and business. And the idea here is to take a look at ideas and then say, how do they affect rural communities? How are rural communities even more challenged than other communities in New York State? And what are the ideas we have that we can take back to public policy leaders to help build and support the sustainability of EMS in New York State? So I'm going to turn it over to Terry for some color commentary on the evidence-based agenda.
Thank you, Steve. So I just wanted to kind of point out to everybody that thousands of hours went into this. I'd be remiss if I didn't thank Mike and Ryan for coming up with this concept. Basically, Ryan and Mike were at a meeting, and I'm sorry, they were at a dinner, and this whole discussion came up about EMS failing and how can we fix the system and what can we do to fix the breaks. Mike was invited to a state council meeting. He made the presentation to state council, and hands went up across the table. Hey, can I get on? Hey, can I get on? I'd like to help out. What can I do? From there, it was a huge amount of people from every source and every resource that came together, and we divided this up and we conquered it. And we took, I think we went pretty much on a weekly basis, anywhere from I think it was like 2 phone calls a week for quite a few months. And then we divided into every other week. So a lot of time and a lot of effort was put into this by a vast amount of people. As Steve said, there's things that even being part of this, I don't agree with, but it's not that I don't agree with it. I think we all have to look at it and we have to see how we can all accomplish most of these. One of the things that I look at and people look at and talk about is the mutual aid. You know, oh, we're going to have to do this, we're going to have to do that, we're going to have to do this. Here's the percentage by this particular time. Understand that this is a recommendation, and the state's not going to walk in and say, okay, so in 3 weeks you haven't made 85%, we're closing you down. That's not the concept to this. It's a matter of trying to figure out how we can make the broken system fixed and how we can make it better. I can tell you the Hudson Valley Remsco has taken on the task of pulling out a couple of the 25 items and what can we do as the Remsco to help agencies go through this 25 recommendations and try to fix them. You know, not recreate the wheel, but fix what's broke. So my recommendation, and I think I speak for NYSVARA, is, you know, if everybody were to take those 25 items and go through them and say, how can I fix this? How can I make this better? Every single one of us can beat these 25 recommendations into the ground and make EMS a better place to be. Steve, did I touch what I needed to touch?
Yes, thank you, Terry. Thank you very much. All right, so before I move on, I'm just going to look into the chat box for a couple questions here. First, Michael Bennett, who is a member of the NYSVARA leadership and heads our rural committee, has put in the chat box the direct link to this document, so you can click on that right now and go to it. And we've got a question from George June. Where did the idea for the CON revamp and EMS districts originate? Was it from the Bureau, individual legislators, or the governor's office itself? That's a good question. It was published by the governor's office, and the governor's office does solicit input from lots of sources in the construction of the state budget, and they don't necessarily disclose where all their information comes from. I guess the answer to that, George, is I'm not really sure exactly where it came from. I know that the Bureau of EMS worked with the SEMSCO on coming up with some ideas. I don't think these ideas came specifically from the SEMSCO, but the Department of Health staff and the Bureau of EMS staff all shared their opinions as well into what was forwarded through the process. So it's not really answering the question, George, but you know, the governor's office input process got this through different channels, I guess. All right, so that takes care of what we've got going on in the chat box. All right, so I'm going to turn now and talk for a few minutes about what's happening at the federal level. And as Henry mentioned in the intro, in addition to being on the board of NYSVARA, I do serve the board of directors of the National Association of EMTs, and I'm the vice chair of the Advocacy Committee of NAEMT. So I get a chance to take some of what we do here at the state and go and talk about it with my colleagues at the national level, and also learn about what's happening at the federal level. About 20 of us from New York State will be going to the EMS on the Hill next week in Washington, D.C. Nope, someone. Nope, okay. About 20 of us from New York State are going to Washington, D.C. next week to talk about at EMS on the Hill, where there are going to be several hundred EMS representatives over the country, all over the country, visiting with our members of Congress to talk about EMS issues. And I thought I'd just give a little bit of flavor for this here.
Steve, if I could just jump in a minute before you.
Oh, Henry, please. Yes, sir.
Yeah, I just wanted to acknowledge some people who were on the call. Steve mentioned a few of them. Mike Benatti, who is also on the Rural Task Force. I want to just give a shout out to our members of the NYSVARA Legislative Committee, Steve, as you know, Mark, Terry Hamilton, Jerry Gelbard, Sean Graves, who work on our Legislative Committee. Also, I see on the call is Aiden O'Connor, who we work with the State Council and is also a member of the Rural Task Force. And we're pleased to have that. I see our EMS Director, Ryan Greenberg, has zoomed in. And I want to say thank you and welcome to Ryan. And I want to thank all of you for being here. One of the things that we've been doing through the past year and some of the people I just mentioned have been involved in that, is that we have been talking rather regularly with our stakeholder agencies at the state level, the Onion, the proprietary folks, as well as representatives from FASNY and the State Association of Fire Chiefs, as well as the Professional Firefighters Association. So we are trying to build a coalition that, as much as reasonably possible, talks with one voice, or at least in a coordinated effort on EMS. And we found a lot of areas of overlap and cooperation, and we could continue to work on that effort for the betterment of all EMS in the state. So I just wanted to let you know that, that is ongoing, has been intensified in the last year. We expect it to continue. We think it's a good idea. We think it'll work for you. I would encourage you, as Steve has already mentioned, if you are not familiar with Part S and what's in the budget, get familiar with it. If you're not familiar with our legislative agenda, please look at it. If you can't find Part S, reach out to us. We will get you a copy of it. But it is important for all of us in EMS to become much more engaged in the regulatory and legislative process than we have been in the past. I think we all recognize that there are, problems in New York State with EMS. And in fact, talking with our colleagues around the country, and as Steve will probably allude to when he talks about the federal program, we hear similar things from other states. So this is not, uniquely a New York State problem. This is a nationwide problem in a number of regards, particularly when it comes to the workforce and funding issues that are facing EMS, as well as the number of EMS practitioners who are certified but not regularly practicing. We heard from some folks in Texas that their numbers, while a little bit better than ours, are not far off when it comes to the number of certified personnel versus the number of people who are actually working in the field. That's something we all have to be concerned about. So, and obviously, if you're not a member of our association, our dues are not prohibitive. I would encourage you to join. That's the only way we're able to do these kinds of things. And without members supporting our efforts and providing the funding to do this kind of stuff, although we're not paying anybody to do this, the communications platform, the website, the information that you regularly receive from our communications guru, Jim Downey, does come in the back end with funding that we have to put forward from the association to support all that. And I want to particularly thank Steve for doing this. I asked him on a very short time frame to put something together and to start the ball rolling on something like this. He was extremely receptive, and we wanted to do it before the state budget is finalized, because we thought it was particularly important that you understand the budget process and how it works and what's happening. So this was a short order that was fulfilled, and I want to thank those of you who stepped forward to do that and to help out, and please get involved. If you're not involved, if you're not talking to your local town, village decision makers, you should be. If you're not talking to you and you don't know who your state senator and assembly members are, make that your assignment for this week. If you don't know what Part S is, read it. If you don't know what our legislative agenda is, go on our website and take a look at it. And please give us your feedback. And thank you to those of you who are taking the time to be involved today.
Thank you, Henry. I'll just pick up on what Henry said. NYSVARA and NAEMT have a great partnership. You can join NYSVARA and NAEMT at the same time. We have a joint agreement on how to do that. It really is not prohibitive. It's something you could do as an agency where all your members can join, or it's something you could do as individually. For the money that you invest, you get Jim Downey's summaries of the state EMS council meetings. We're going to try and do more webinars like this. We do have some members only resources we put out there, but something Henry said that's really important is we really have begun forging alliances here in New York State between all the different groups. So the EMS groups that represent firefighters, the EMS group Onion that represents the commercials and hybrids, the NYSVARA that represents the voluntary and hybrids. We're working together on an agenda for going forward. And at the same level, at the federal level, you know, there's a group that works together as well, the NAMT and the AAA and the International Association of Firefighters, for example. We are a relatively young profession. EMS has only been around since the days of Johnny and Roy in the 1970s is when EMS really took off. We have a lot of ground to make up with other organizations. The hospitals have been around for hundreds of years, and so have firefighters, and so have police agencies. So we're making up for lost time trying to become very engaged with our elected representatives. All right, so to go back to the federal legislative issues, here's a smattering of what's going on at the federal level. The first thing is we have managed to get legislation passed that will provide assistance for rural EMS training and equipment. It's a siren program. It's somewhat similar to perhaps conceptually the assistance grants for firefighters. But it's a small program. It only has about $10 million a year for the entire United States. That means maybe 50 agencies can get a grant. We're working hard to expand the siren program so that it could be something that rural agencies all over the nation can get involved with. And we're also looking at ways, how do we expand it beyond rural? But the next step is to make it a little bit bigger. The next issue is funding for all hazard preparedness. The All Hazards Preparedness Act has a hospital preparedness program. And for some reason, the hospital preparedness program, when it was conceived, is got money in it for more than hospitals. It has money for all sorts of medical providers, but it did not include EMS. So we want to see inside the All Hazards Preparedness Act, a EMS preparedness and a workforce shortage program that provides funding nationally for EMS agencies to be prepared for all threats, all hazard threats, and to cope with the workforce shortage. And as Henry mentioned, we're not the only state that is seeing a decreasing number of EMTs and paramedics. And if you were to go into the internet and Google workforce shortage EMS, you'll see articles all over the country about our colleagues speaking out about the difficulty that they're having. And so we want to see federal funding to boost that workforce and to boost our EMS preparedness. The next thing is something that you heard us talk about already, and that's the transport to alternate destinations and the treat in place. That is allowed by Medicare as part of the ET3 program, but there are only about 120 ET3 program agencies in the country. It's a very small demonstration program. We want to open it up to all EMS agencies in the country to participate in these endeavors. In addition, there was some allowance for this to happen for Medicare during the pandemic. When the pandemic emergency, so the public health emergency expires in May, and when the public health emergency expires, that authorization expires. So we're working hard to make treat in place and transport to alternate destinations a feature of the Medicare program into the future. Fourth, there's an act called the EMS Counts Act, and this one is a little bit quirky, but it's worthy of a minute or two of explanation. Right now, the Bureau of Labor Statistics collects workforce participation statistics. They know how many police officers there are, they know how many firefighters there are, they know by state, they know by county, they know how many teachers there are. They do not know how many EMS workers there are, because there is no category for a firefighter that is also a paramedic or also an EMT. So today, if you check the firefighter box, but you're a firefighter paramedic with the fire department, you do not get counted as an EMS worker. So this is defined in legislation and in the law, so we need to change it. So we're trying to add a category. So firefighters will be separated into firefighter, firefighter EMT, and firefighter paramedic. That is the only way we can think of to get an accurate count of all of the EMS responders in communities, because if you pick the firefighter box, you can't also pick the EMT or paramedic pre-hospital care provider box. The last thing is we're asking for Congress to hold congressional hearings on the EMS workforce crisis. They've already held some hearings on the nursing crisis. We believe that we have a similar level of crisis, and we'd like those to be held. So that is the features of the federal agenda. If you go to the NAEMT website and you look on the advocacy overview section, you'll find a couple of things. First, you'll see right in the middle, what is EMS? That document was written by NAEMT for you to be able to introduce your member of Congress or your state legislature to what is EMS. We are not just ambulance drivers, right? And we battle misperceptions about who we are and what we do for many years. That was written specifically so you can go to a member of the legislature or a member of Congress and say, this is what EMS is. That's available for download for NAEMT members. On the left and right are two documents on grassroots advocacy, how to influence your elected officials, grassroots advocacy guide, and things you can do. We're going to do another webinar on grassroots advocacy and what people can do in the not too distant future, and bring in some other speakers to talk about that. Lastly, there's what's called the online legislative service, and the online legislative service is a place where you can send a letter to your member of Congress just by filling in your name and address. It picks out who your member of Congress is. We've got some pre-written letters in there that you can send. So there are some items. I keep a list of, as a member of the NAEMT Advocacy Committee, I keep an alert list. When there's advocacy alerts, I send them to people around the country, around the state rather, to let them know what's going on. At the end of the presentation, my email address will be in there. If you would like to be added to the NAEMT New York Federal Advocacy List, so you get advocacy alerts, please just send me an email that says put me on the list. And like I said, NYSVARA and NAEMT really work in partnership. So, okay. All right. Next topic up is New York State regulatory discussion on ambulance offloading delays. We all know what wall time is. We've all had to wait to drop off our patients. It's been more severe from time to time. It was after a while, we got to a point where we went forward and spoke at the State EMS Council meeting. We had a long discussion about this. Same thing at the State Medical Advisory Council. As a result, the Department of Health decided to put together a work group on this topic. And so they assigned the Public Health Council, Public Health and Planning Council, which oversees the hospital system. They asked their planning committee to hold a hearing on ambulance offloading delays, and representatives of the SEMSCO and the CMAC appeared before them to talk about this issue. It was the first beginning of a discussion about this topic. The Department of Health presented a lot of data. The Bureau of EMS presented a lot of data on ED. That's where I got the numbers on the workforce shortage from. And there is a slideshow that's available on the Public Health and Planning Council's website. If you really want to watch the webcast of the hearing, you could watch the webcast of the hearing. But I do want everybody to know that we have been heard. NYSVARA has been heard, Onion's been heard, FASNY's been heard, the Regional Council have been heard. The Department of Health understands that we have a severe shortage of workers already, and that it is hurting our readiness for our communities when the hospitals are unable to get our patients off the stretchers and into the hospital rooms promptly. That's because there's a whole bunch of challenges in the hospital system that we could spend the whole call talking about. But we felt it was important that the hospital system understood that their throughput issues were really beginning to undermine the ability of EMS to be successful. That was accomplished through the hearing. It's the first part, it's the start of the discussion. It's not the end of the discussion, but we wanted everybody to know that that this hearing took place, and that you can view the hearing and get the material from the hearing as well as you go forward. And okay. we got a comment in the chat. It's kind of going off topic, but it's from Gary Heckler. If your name does not show up on a PCR within your recertification cycle, you should not be eligible for reimbursement except for extenuating circumstances. I think that's a good point to make, Michael. I'm sorry, Gary. Thank you for sharing that comment with us. And Michael Bennett has also put in the chat the link directly to the NAEMT agenda. So again, we don't tell you about the ambulance offloading delays for anything other than it being an educational tool for you, something you can get involved with. I'm going to show you what my agency did so we could do it with our lawmakers. I noticed my agency logo was backwards when I pasted it in there, but sorry about that. But we took a look. We use EMS charts as our EPCR system, and we decided to measure for 2022 how long is delays in transfer of care. So when we arrive at the hospital until the unit gets back in service, we call back in service. As soon as we get in the truck on the ambulance deck at the hospital, we call back in service. So we measured in 2022. And once we measured it, we were able to multiply that out and do the math. So for example, on 20% of our transports, we waited 45 minutes or longer to drop off the patient. That is 553 times. You can do the math of, how long that is. We waited 60 minutes or longer 250 times, or on 9.1% of our transports. Our time exceeded 90 minutes till we were able to offload the patient and have the hospital crew take over care 50 times in 2022. Any one of us that's riding today, you know how it feels when you're on that call, when you're waiting for 90 minutes. We had a waiting time of over 4 hours on one particular day, where 2 of our ambulances sat at the hospital for 4 hours when we only had 3 ambulances in service on that shift. So this is something public policy leaders need to know about. So we've told our town that when we have 250 calls where we're 60 minutes or longer, that's 250 hours of ambulance time that's not available for the general public for the next emergency. So we share these statistics on our website. We let our public policy leaders know, our town knows, our community knows. And by measuring this, data helps drive change. So, I sent this data to people in elected office and said, look, this is why we need to be dealing with this. So that's just an example of what you can do to take a look at the delays in transfer of care. Okay, so we're approaching 8 o'clock and we wanted to keep the presentation to an hour, so we're doing pretty good. And then we can stay on for some dialogue and questions and answers. The last thing I want to talk about is the local tax exemption for volunteer firefighters and ambulance workers. We're getting a lot of calls at NYSVARA from people about how do we do this? Chapter 670 of the laws of 2022, a law that we supported, was put in place that allows for a government body, meaning a town, a city, a county, a school district, to offer an exemption of up to 10% of the assessed value of the primary residence of a volunteer firefighter and or volunteer ambulance worker. There's a minimum service requirement, meaning that the local jurisdiction can set that service requirement at both either 2 years or 5 years for volunteers to become eligible. In my community, we chose 2. And that exemption becomes permanent to volunteers or their survivors that have 20 years of service. So if you're an active EMT riding now, and this is your 21st year, that would be a permanent thing that would carry on to your spouse if you were to be deceased, as long as you own that property. Now, as I said earlier, you can't take the local tax exemption and the New York State tax credit. We're trying to fix that. But people have asked, what do we got to do to get the local partial property tax exemption? First, the property must be owned by the volunteer ambulance worker. Second, it must be the primary residence. Third, it must be located within the jurisdiction served by the ambulance entity to which the volunteer belongs. And several people have mentioned to me that doesn't work for everybody. So if you live outside the jurisdiction, for example, my ambulance squad has members that are in more than one school district. Only one school district has passed this. If you own a home in that school district, you can take advantage of it. If you own a home in the neighboring school district, you can't. The property must be used exclusively for the volunteers' residential purposes. and the authority having jurisdiction must certify that the volunteer is a member of the ambulance service. So you have to set a standard. What does it mean to be a member? Does it mean that you ride every week? Does it mean that you're on the roster? Does it mean that you hold elected office? So that's the criteria. People have asked me how to do this. The best how to do this guide is a members only resource that has been developed by FASNY. We at NYSVARA haven't had the resources to put together our own set of tools, but what I've been doing is recommending to volunteer ambulance squads is work together with your volunteer fire departments on this, because we want all the volunteer ambulance workers, volunteer fire workers to get the same exemption. Frankly, many of us do both. Or join FASNY, joining for the amount of the benefit that could be received by the members of your organization. Joining FASNY so you can have access to these resources is great. Last thing to cover before we open up a discussion is next steps, being an advocate for EMS. And we're going to have another webinar on advocacy for EMS, but I'll give you just a couple bullet points here. Communicate with your elected officials about the issues we discussed today. Ask them to be advocates on your behalf. They should support the Medicaid payment increases, support funding for EMS education, recruitment, and retention, support the new definition of EMS and mobile integrated healthcare. I realize that not everybody on the call tonight is a volunteer, but we are the New York State Volunteer Ambulance and Rescue Association, so we're particularly interested in increasing the volunteer ambulance workers tax credit. We are interested in supporting direct insurance reimbursements so our agencies can get paid whether or not the insurance plan is participating with our ambulance squad or not. And we support enactment of the uniform ambulance assessment program that we are pleased that our Onion friends have brought it forward and asked us to be part of it with them. So I'm going to go into the chat, and it says Sean Graves asked, is the 20-year credit retroactive? It is. You have to have been active and engaged for 20 years, and you still have to be doing it. So, for example, I am in my 21st year of membership at Delmar Bethlehem EMS, so I am qualified for the 20. It goes back. It doesn't mean you have to be there for 20 years from now going forward. I'm not going to make it another 20. Then Mark Devers has put in the chat box a feedback form so you can evaluate this webinar. So if you want to go to that and click on the link, you can give us a score. So we've talked about our next steps. A couple last things here. Visit your state legislators. Mark mentioned to me that up in the North Country, he went with people from some of his neighboring agencies, and they went together and they visited state legislators. You can set up an appointment at their office or today by Zoom. You can visit with their policy staff by phone, by Zoom, by email. You can invite them to visit your agency. Get involved in the federal EMS advocacy. Again, you can get on the NAEMT New York State alert list by emailing me at that email address, legislation@nysvara.org. To get copies of these slides, email me at legislation@nysvara.org. So we've talked a lot. We don't have there's a good number of participants on here. Terry Hamilton has got her hands up, but I think we're ready to go into a Q&A and comment session. So Terry, we're going to start with you.
I do. I just want to answer. Tamisan had asked a question: what if you can't afford to own a home and or a renter? Tamsin, that hasn't been addressed to my knowledge or to our knowledge at this point. Stephen, Mark, and I were talking about that the other day, and the fact that they're offering this to to homeowners, it's a start. We have to start someplace, and this is more for us to work forward on and move on as well. But it's a start, and we have to start someplace. And and I apologize, and I don't disagree with you. I don't own my home either. So I have to do the $200 personal one. I can't do anything for the homeowner.
That's a great point, Terry.
Right, Terry, that's a good point. One of the reasons that we, as Steve mentioned, are supporting an increase in that $200 credit is because we realize that the property tax abatement is not available to people who are renters. So, you know, the general tax credit would be, so if we can get that 200 up to 500 or 1,000, that would certainly help those people who are renters. Just another note, I've tried to mention everybody who's been involved with us and working. I'm sure I missed somebody. I think Steve may have mentioned them, but just in case not, Mike Bennett, who is also from just south of Canada area, upstate in the North Country, is also a member of our legislative committee and is chair of our rural EMS committee. So you know, he's another person who is engaged and involved and knows rural EMS issues, which we know is a particularly important subject for vast areas of New York State.
Right. Thanks, Henry. So NYSVARA members, we would love to hear from you. And I'm sure there's some folks on here that are not NYSVARA members. We opened this up pretty broadly. I guess we're open to comments and thoughts from everybody.
Hey,
So,
Steve, Gary Hecker's had his hand up for a little bit, so I'll
all
let
right.
him
Go
jump
for
in.
it.
Hi, I had a
Larry.
question going back to the hospital offloading. My day job, I work in a hospital, and we've been riddled, you know, between COVID and, you know, not counting the lack of workforce, because we've been losing a lot of nurses and other staff members. But during the pandemic, we hit a crisis, and more recently with the RSV and flu crisis, we hit a big issue with holding 50 patients in the ER, and so we were able to open up some more beds. But over the last several decades, there are many hospitals in New York State, particularly in the downstate New York City region, that either closed voluntarily by force because of financial issues, or the lovely Brooklyn Hospital redesign plan that closed down several hospitals, and we've lost probably thousands of beds in this state, which we were able to absorb over time until we hit critical mass starting in 2020. So is the Department of Health looking at, you know, fixing the problem of lost beds and how to better redistribute beds? New York City is looking at, in the Rockaways, there's an issue with no reasonable trauma centers within an area, you know, reasonable drive for the Rockaways. That's something that the city is starting to look at. So there's a shortage of workers, but there's also a shortage of places to bring the patients. And it's something that the state kind of started by allowing this to happen. An ambulance service can't close without going through a lot of hoops. Hospitals, you know, have gone through the hoops, but it just doesn't seem like the impact on the community at large was looked at, and now we're at a major crisis.
So Gary, you raise a really great point that I think is important to make to public policy makers. One of the things that I've noticed over my career in healthcare in New York State is we've developed a just-in-time philosophy. We don't want to have extra capacity. And so we have done lots of things to get rid of extra capacity during good times. Well, then not so good times come. So a hurricane, a pandemic. Well, if our system is built to only handle our normal volume and there's no surge capacity, we have problems. So now we have a system that is shrunk. And so I know that there are a number of initiatives. If we were to read the hospital provisions in this state budget, there are some provisions to address that, but it's a really big systemic conversation we have to have in general. And you framed it well. What capacity do we need to have? What do we need to be ready for? There will be another incident in our history where we need to increase the number of people that are in hospitals. And so how do we make sure we have that capacity? How do we make sure we have that capacity in an urban community like you talk about in Brooklyn? How do we make sure we have that capacity, say, in the North Country, up where our hospitals are further apart? It's an important piece of the debate, and it's an important thing for us to be talking about as advocates. So thank you. All right, the floor is open. So tell us, what are there other things we should be thinking about and working on? Do you have an opinion on anything here that we're talking about you'd like to share? This is a great chance for the NYSVARA members and others to share their thoughts.
Just everyone who's still on the call. There is a Google form. It does work now. I apologize. I forgot to take the security off. You know, we want to do more of these in the future, so please take a moment and fill it out if you would like us to kind of guide us in where we go. And Mike Bennett has his hand up.
Oh, Michael.
Hey, thanks, Steve and Mark. Just on behalf of the rural EMS committee for NYSVARA, I just wanted to say thank you, everybody who has been on for the last hour. Steve, this was a phenomenal presentation, and I think that we've had a lot of good dialogue going so far. And I did just want to let you guys know that in the meetings I've had with my assembly members, although they rejected some of the language in Part S, they're not necessarily opposed to it. The conversation I had was that they wanted to go through the legislative process versus going through the budget. So they're open to the idea of some of the changes we've discussed, just they don't want it in the budget.
So, Michael, you raised a really good point, and I would like to definitely address it. There is some conversation in the EMS community is why is Part S being done in the budget? Why is it not part of the regular legislative process? I don't set the way we do legislation in New York State, but the New York State has developed a budgeting process that has taken on more and more responsibility for legislating. The Senate and the Assembly and the governor all have arrived at the place of us doing most of the budget, most of the legislation that gets done in a year gets lumped into a big budget bill. There are political reasons for that. There are practical reasons for that. I'm not saying it's good, and I'm not saying it's bad. I think a lot of folks in the EMS field would like there to be this not to be done in the budget, but to be done through the regular legislative process, where there would be a series of hearings and a series of legislative sessions. That's not, frankly, that's a good idea, frankly, but all I can say is that's just not how they do it today. And it's a commentary on the just how our state's legislature works. So I know a lot of us would prefer this to be done through the regular legislative process, but we really don't get to make that choice, in the sense that the governor and the two houses of the legislature have chosen how they do the budget in New York State and how they legislate in New York State. So we ultimately have to make the decision, can we live with the way they do it or not? But if we tell them that it's unacceptable for them to do it in the state budget, they may just take it out of the state budget and not do it at all. So, that's sort of the answer to that. Don Hudson asked, what is the process for Part S making public comment and to making changes before it becomes law? Great question, Don. You can meet with your members of the Senate and Assembly right now and say, this is what I agree with, and this is what I don't agree with. The Assembly and Senate have done what are called their one-house budgets. And so now there are going to be conference committees. Used to be referred to as 3 people in a room. I think they've broadened the process out. It's not just 3 people anymore, but the concept is the Assembly comes with its position, the Senate comes with its position, the governor's office comes with their position, and they hash out these things. It's going to occur over the next 2 weeks. Now's the time. If you've got something that you really feel is important, go to your senator and go to your assembly member. I think this needs to be changed, and ask them to go to their leadership. So to the Speaker of the Assembly, the Majority Leader of the Senate, the Minority Leader in both chambers, and say, hey, I need this one to be changed. I need this one to be fixed. It could be deleting something. It could be fixing something. I mean, if you feel strongly that it should be done in the regular legislative process, that's the way to say it. So now's the time to do it. But this won't be our only bite at the apple. When and if these things are passed into law, the laws leave a huge amount of space for interpretation. for the regulators to write the regulations that implement these laws. The SEMSCO will be involved in the regulatory process. The regulatory process also requires public comment. There will be lots of opportunities if this doesn't come out exactly the way anybody on this call wants it to help shape that going forward, to participate in that regulatory process. So the concepts would get frozen into place if the law gets passed, and then we have to figure out exactly what everything means. So Don, great question.
Right, and I think, you know, what Steve mentioned and what Mike mentioned highlights why it's so important, particularly in New York State, to remain legislatively aware. Because in New York State, as Steve pointed out, a lot of this, like it or not, I don't happen to like it, gets done in the budgetary process, which doesn't really afford a lot of time for hearings and discussion. So it really isn't the ideal way to make legislation, but that's the reality we're dealing with in New York State.
Right.
So it really points to the fact that we, you know, much more than in some other states, must be aware of what's going on in our legislature, and we must be aware in a timely manner to do it, because this very short time frame, if you know some of the statewide organizations didn't step forward and talk about what they really liked, what they really were concerned about, this could very easily have gone by the wayside very quickly. You know, while it's rare, it does happen if there have to be some legislative wording changes. But really, in order to affect that, we need to get all the stakeholders on the same page and go into the legislature and say, you know, we like it, but we request the following changes. And that's very hard to do. Right. So the thing to do is to, you know, as soon as you can, express your concerns to your legislatures, because the only way that, you know, having something happen or not happen is when enough legislators go to the leadership in each house and say, we're hearing from our constituents, and enough of those leaders hear similar messages from different legislators, then something tends to happen in New York State. But it's a, you know, it's a much more difficult process than it perhaps is in many other states. Shouldn't be, but you know, as Steve said, that's the reality we're dealing with.
Right. Thanks, Henry. Marie Diglio asked, are there plans to go back over the entire Article 30? We obviously couldn't do it on this call. We're an hour and 19 minutes in, and you know, we had a lot to cover. But NYSVARA has gone over Article 30 revisions, the Part S, in great detail. Henry submitted some comments on the thing, just like Henry just said, on things we like and things we don't like, and specific recommendations for changes. I think over the next 10 days, NYSVARA will be working, like a lot of other groups, on trying to make improvements to it. Ultimately, people have to decide what, you know, where they are on this. I don't know that we're going to have another webinar in the next 10 days to go over it with the entire membership in great detail, but we do want people to share their thoughts on it with us. The State Department of Health is hosting 3 seminars on this for REMSCO members and SEMSCO members and REMAC and REMSCO members and REMAC and CMAC members. That's hundreds of EMS leaders, many of them that are on this call have been invited to those webinars. That's where the Department of Health is presenting on what's in Part S in greater detail than what we were able to present on tonight. I encourage you to, if you're a REMAC or REMSCO member, and you know that's hundreds of people, to go. If you can't go, there's one more left. Get someone on your you know, who's on, represents you on the REMAC or REMSCO to take good notes, to brief you on it, so that, and I don't know if the Bureau of EMS will make those slides available or not, but that's a way for you to get more knowledge on Part S as well.
I see Chief Benatti has his hand up, Steve.
Michael, hi there.
Good evening. I just wanted to take an opportunity to thank the NYSVARA team. You guys did an outstanding job with this presentation tonight. And, you know, I think that the key here, right, certainly is, as many of you have heard me say, we need reform and we need it now. And the way that we're going to get this reform is by the communications and the cooperative relationships that we've established over the last couple of years, and certainly just want to continue to encourage everybody to continue to work together. Not all of the topics, right, that we address are agreeable to all folks. And, as we clearly said, probably if there were 100 items, most of us agree on 95 of them, and we can probably come to a compromise on the other 5. So just outstanding job to the team tonight. Really nice to see. I think that these forums are outstanding to get the message down to the agency level and to the support that we need to continue to ensure that when somebody calls 911, they get an ambulance. So great job to the team. Thank you.
Right, and thanks, Chief Benatti, for your work on which really spurred a lot of this forward. As Terry mentioned, there are some very high goals in the paper that came out, and while they may not all be practically achievable, it's not necessarily a bad thing to try to achieve or move toward a high goal. And certainly as we look to implement some of the recommendations, we have to look at, the ideal and match it with the practical. But I think everybody really pretty much agrees across the spectrum that we absolutely have to move forward and move in that direction. So, I would encourage all of you, read the white paper, agree or disagree, let your thoughts be known. But I think we can all agree we need to improve and move forward with EMS in New York State.
All right, so we're going to give one last, I'll open it up to anybody to say anything about any topic. All right. Well, then, thank you everybody for coming tonight. We'll be putting out a message about when our next presentation will be. Again, you've got, if you want to just real quick, go into the chat box and tell us your evaluation of tonight's presentation. Type in there if there are any topics you want us to cover next time that we didn't cover tonight. And thank you everybody for coming. And Henry, I'll leave it to you if you want to get the last word and say goodnight.
Just want to say good night. Thank you for all coming, and please stay engaged, stay involved, stay safe, and be well.
Good night, everybody.
Steve, thank you very, very much.
Hey, thank you for setting this up. This worked out really nicely.
So,
All right. Good night.
have a good night.
Yep. Bye.
Good night, everybody.
Definitely.
Night, guys.
Good night, all.